Information on breast cancer signs and symptoms. Breast cancer symptoms can reflect differently for many people. Some people may not know what to look for when they're checking for breast cancer. Today, I will explain exactly what breast cancer is and how to check for signs and symptoms of breast cancer. So, what is breast cancer? Breast cancer is a disease of the cells within your breast, and this could spread rapidly. Breast cancer is commonly found in women, but also can be found in men. Breast cancer can also spread throughout different parts of your body. Just to give you a little bit of anatomy of your breast. So your breast is composed of adipose tissue, which is fatty tissue, lobules, ducts, lymph nodes, and lymph vessels. So your lymph nodes connect with your lymph vessels and creates a barrier. And this barrier fights any infectious disease that comes its way. Symptoms of breast cancer. Some symptoms that you can experience when having breast cancer is painfulness of your breast. You could develop lumps around your breast, and this includes lumps or tumors in your lobules, ducts, or under your armpit. You also can experience nipple discharge or redness around your breast. Two common kinds of breast cancers are ductal breast cancer, which is cancerous cells that lines your milk ducts. Also lobular breast cancer. This is when cancerous cells are formed in your lobules. Now, within these two common cancers or breast cancers, you can have invasive or non-invasive. Invasive basically means that you have cancerous cells that starts in either your ductules or your lobules, and they expand throughout your whole body. On the other hand, non-invasive is basically cancerous cells that starts or only is located in your ductules or your lobules, and they don't spread throughout your body. Some stages or processes that the doctor usually likes to take when you are diagnosed with breast cancer is staging. Staging is basically a process that the doctor wants to know or determine whether the cancerous cells within your breast is invasive and how far they exactly spread throughout your body. There are 4 different types or stages with breast cancer. The lower the number, the less likely of cancerous cells that spreads throughout your body. Now, the higher the number, the higher amount of cancerous cells spread throughout your body. Statistics of breast cancer. National Cancer Institutions, according to the reported evidence, estimated a risk of developing breast cancer within a 10-year time frame. So by the age of 30, the percentile of you developing breast cancer is at a 0.49%. As you go into 40, your percentile rate for developing breast cancer is at a 1.55%. Now, as you can see, as you go up in age, this percentile increases. So it basically proves that as you get older, your estimated risk of developing breast cancer is higher. There are a couple screenings that you could take in order to check if you have breast cancer. These include diagnostic tests with your primary care provider, ultrasounds, mammograms, MRIs, and PET, which is position emission tomography scans. You also could do a self-examination. So within self-examination, I just want to break down exactly how to do this at home. You could do this in the shower. You could do this in front of your mirror or laying on your side. So what you want to do is raise your arm, take your 3 middle fingers, place it below your armpit, move downward in a circular motion throughout the outside of your breast. Move inward towards your nipple. Now, what you're checking for is any kind of lumps, masses, or tenderness. If you do feel any kind of lumps, thickness, thick masses, or tenderness, you may want to contact your primary care provider to see what steps you could take to move forward. There are different screening clinics, and I listed them here, and they're pretty local within Western New York. This is my cited page. Thank you so much. October is breast cancer awareness, so make sure you get your pink.